Dr. Gulleria, everyone wants to know, I think that's the most commonly asked question is, what should we do? Should we now, from tomorrow onwards, just start wearing the masks? I mean, at the end of the day, the government has held this meeting after months together. Also, we have the upcoming festive season, so social distancing norms, should that be looked into right away?
So I would really say that those who are at high risk, the elderly and those who are having comorbidities, should be extra careful. I would still advise people to wear masks because that's a good measure not only from COVID point of view but from other viral infections including influenza and tuberculosis. And in areas where air pollution is high, the mask also prevents or protects you against air pollution. So it's a good thing to do. And also I would say that if possible, try and avoid crowded places, especially during the winter months, because you tend to stay more indoor, and if the ventilation is not good enough, then a lot of viral infections tend to spread, and you can get influenza and COVID-19 because of that. So precautions during winter months are important, and we must continue with that because all prevention is always better than cure.
Now, the Indian public, Dr. Gulleria, is going to be very upset hearing that from you because, like Sneha said, it's the festive season, it's Shadi season everywhere in the country. So, I'm going to repeat that question. Are you saying that, big gatherings should be avoided at this time?
So currently our situation is good. We are not seeing increased hospitalization or deaths. So I don't think that I would say that we should go back to what we were doing last year in terms of total ban in all these activities. But like I said, the high risk group, if possible, should avoid crowded places where chance of infection is high. And even if they go to these places, they should wear a mask, and hand washing should also be done. But a total ban on such activities I don't think is warranted currently. We are not seeing that type of cases in our country. We need to be vigilant, we need to take precautions, but we don't need to have a panic situation.
Dr. Gulleria, always a pleasure hearing a sober voice, full of information and advice from someone like you. It's good to see you back. I wish it were in better circumstances, but here we are on, the potential foothills of another COVID crisis here in India. We will not scare people here. We will only have people like Dr. Gulleria and Sneha on here to give you the information that you need in a timely fashion. Dr. Gulleria, a pleasure. Thank you very much for being with me. And Sneha, I was hoping that things like hand wash and quarantine and social distancing and masks were words that could have been cast out of our lexicon. Sadly, that is not the case, and we have only China to thank. Remember, Sneha and her team will continue to track the story very closely.